Okay, so we have all the attendees just flowing in right now. Very good morning to all of you. Hi, and welcome to this month's health talk on ovarian cancer awareness month. All right, so lots of people are flowing in right now. Yeah, Dr. Teo. I think you can see the participant box right at the side over there. So we're gonna be having quite a number of people just going in, going out as the health talk progresses, but that's completely fine. So yeah, again, good morning to all of you who are here. And we are going to begin the webinar very shortly. So I'll just give everyone just like maybe 1 or 2 more minutes to stream in, and then we can officially begin with this webinar. Yeah.
Sure.
All right, then. All right, so we're all good, doctor? Yeah, let's
Yep.
get this started, yeah? All right, perfect. Okay, all right, then. Someone has raised their hand, but that's completely fine.
Just let me try to share the.
Yeah, you can go ahead and try and share it first. It's completely fine. Yeah, good morning to all of you. It's perfect, doctor.
Okay.
It's perfect. Yeah, that's great. All right, then. So we will begin now. All right. So once again, good morning to all of you who have decided to attend Cancer Research Malaysia's, one of Cancer Research Malaysia's monthly webinars. And for our topic today, it's symptoms, risk, and a bit of magic about how we uncover ovarian cancer. So this is essentially in conjunction with Ovarian Cancer Awareness Month. And yes, it's in the month of May. So there are many things that we often overlook in terms of ovarian cancers. We can mistake some very common symptoms as something else, but we don't think of it as ovarian cancer. So essentially, this means the symptoms for this type of cancer can be mistaken for other conditions. So joining us today is Dr. Teo Ik Hui from Universiti Malaya Medical Centre, UMMC for short, as we explore this silent killer which affects Malaysian women. So hi, Dr. Teo. Very good
Hi.
morning to you today, and thank you so much for agreeing to be part of this webinar. So how are we feeling today? All good?
Yep. Good. Thank you for the invitation. I'm
Yeah.
happy to be here.
Yeah, that's amazing. Really, it's a really real privilege to have you here. I'm very happy for that. So, without further ado, I suppose that we can actually start the webinar right now. That's fine with you. I'll just begin with
Yep.
the questions. All right, perfect. So, first and foremost, could you tell us a little about yourself and the work you do?
All right. So I'm Dr. Teo. So I'm currently practicing. I'm a ONG obstetrics and gynecology specialist, currently practicing in Universiti Malaya Medical Centre. So I'm also a gynae oncology trainee at the moment. So basically, gynae oncology is a subspecialty, is a part of the gynecology as well, where we specialize more into gynae cancers. For example, one of it is the ovarian cancer. Yeah. So we involve because it's a teaching institution. So we are involved in a lot of research as well in the UMMC. And along that, we also do we are also one of the biggest center for a referral center for gynae cancers. Yeah.
I see. Oh yeah, Dr. Teo, if well, for those of the attendees who
Mhm.
may not know what is the definition of a gynecology and obstetrician, could you maybe tell them what it actually means?
Sure. So
Yeah,
obstetrics and gynecology, or in
yeah.
short form, is called ONG. So they're both linked together, closely linked together. So basically,
Okay.
obstetric means the care for pregnant women, and
Okay.
so more
Mm.
specifically for pregnancy. Yeah,
I
they
see, I
deal
see.
with pregnancy, delivery problems, and things like that. But for gynecology, it is
Mm-hmm.
more about women problems, health problems. For example, if you have problem with menses, fertility problems, It's all falls under gynecology, but obs and gynae as a for our training, for our specialty training, we will need to do both. But
I see.
but after a few years, you can decide to do a subspecialty where you can concentrate more on gynecology, and especially in gynae oncology, where you deal more
I
with
see.
cancers. Yes.
Okay, got it. All right, so can you tell us what is the current situation on ovarian cancer here in Malaysia?
Right. So I will cover that more in my slides later. But
All
ovarian
right, sure.
cancer in Malaysia at the moment, it is the top five, number five actually, of highest cancers for women in Malaysia. So the incidents have slightly increased compared to 5 years before.
Oh,
Uh, but it has, but it has not increased like in a lot. So it's not only in Malaysia but in the whole world as well. The incidence has slightly increased. Um, it's probably because of detection as well. Yeah, more
okay.
detection,
Yeah.
more health screening. It was done for public, or more awareness was done
Mhm.
the public as well.
Yes.
So hence the increase in the incidence. Yeah.
I see. Yeah, that makes sense. Yep.
Yeah.
Okay.
So
So, what have you prepared for the slides over here? Yeah, it's been a
so
while since I've had someone prepare some slides. I think that would be very useful to well, show the audience what your points are. Yeah.
yeah. So um I will just introduce a little bit about what is ovarian cancer, what are the early
Okay.
symptoms of ovarian cancer,
Yeah.
a little bit of information about the staging, uh,
Mm-hmm.
about the treatment, as well as
Uh-huh.
of a misconception around ovarian cancer. So I will speak
Okay. Perfect.
about it. Yeah.
All right.
Yes.
So you can go ahead and show us what you have, Dr. Teo.
All right, sure. So ovarian
Perfect.
cancer, it's also sometimes can be called a silent killer
Okay.
because a lot of times ovarian cancers are diagnosed, half of it actually diagnosed in advanced stage, stage 3 and stage 4. So hence it's called ovarian cancer. So a bit of anatomy for, because this is a talk for the public, so a bit of anatomy. A lot of times women confuse with uterus or the womb and the ovaries.
Uh-huh.
It's all
Mm-hmm.
in one, it's all in one system, but actually best, so actually can I get a
Yep,
point?
I can see your cursor. It's moving. Yep.
Is it moving?
Yeah, it's moving. It's perfect. Yeah.
Okay, right. So just a short, just to explain to everyone. So this part is called the uterus or womb, right?
Okay.
So
Yeah.
ovaries are two small white appendages connected to the uterus. And the function is actually to produce hormone, mainly estrogen and progesterone. So, and
Okay.
other than that, it also produces egg as well for
Yeah.
pregnancy purpose. So the egg will flow, or was it move
Uh-huh.
into the tube, fallopian tube, and if let's say it
Yeah, down there.
occurs,
Mm-hmm.
yep, if
Over here.
fertilization,
Yep.
yep, the baby will implant here. So at the lower part of the uterus is the cervix, which is the neck of the womb, and below that will be the vagina. So
Okay.
ovary, it's hidden in the tummy of the woman. So that's why when you have so the symptoms, especially in the early stage of ovarian cancer, the symptoms are usually very vague, and people will usually, and also the symptoms often overlap with other symptoms as well, and they are not very specific symptoms. So that's why
Okay.
it's called a silent killer.
Yeah,
Yeah,
I see. I can see why it's all internal. It's all packed in there. So you
exactly.
can't even see what's wrong with it.
Correct. You cannot even feel, and when you start to feel, or we can feel something growing in the tummy, it's often
Bad.
or
It's a
very,
bad sign.
yeah, it is. So this is the
Uh-huh.
statistics, the latest statistics for the most common cancers by gender. So you can see
Okay.
ovarian cancer remains the number five, but the incidence has increased slightly compared to the 5 years before, 2012 to 2016. This is the latest statistic, 2017 to 2021. It has already,
I see breast is still the top one.
yeah, breast is always the top. Yeah. And
Okay.
ovary is number five.
Still top five, yeah.
Yes. The other thing is uterine cancer. It has already increased from number 6 to number 4. So there's
Ah,
another.
is this an incidence rate for Malay? Oh, it's by the
This
world,
is
so it's
Malaysia.
not just Malaysia.
This is Malaysian statistics.
Malaysian
Yeah.
statistics because it
This
says
is
age standardized rate world, so I thought it would be worldwide.
that's the rate that they use, the edge standardized rate. Yeah.
I see. Okay, okay. So for Malaysia, okay,
Yeah.
noted.
Yep. So
Perfect.
for edge specific incidence rate, it usually happens between 55, edge of 55. That means after menopausal, 55. The
Uh-huh.
peak incidence is from 55 to 70 years old. So that will be the.
Oh, I see. Okay.
And if you can see on the lower part of the slides here, uh,
Okay.
the lifetime risk generally is about in every 147 women, one will have an ovarian cancer. So that's the risk. Yeah.
I see. I see. And you've even subcategorized it into the three common races here in Malaysia.
Yes. So this information is actually available online, and this is
Ah,
published by the Ministry of Health, the National Cancer Registry.
okay, okay,
Yeah, this is the
perfect.
official
That's good.
statistics. Okay.
Mm-hmm.
And this is another point that I want to show is you can see nearly half, more than half of the ovarian cancer are diagnosed in stage 3 and stage 4. Yeah,
It's too late by then. Yeah,
correct. So
unfortunately.
when you start to feel something, when you can feel something which is abnormal, is often stage 3, because in stage 1, a lot of times you will not have any obvious symptoms.
Oh, I
Yeah.
see. I
So
see. Okay, that's quite alarming if you think about it.
it is. That's why it's called a silent killer, because it's all hidden inside. Compared to breast or other cancers where you can see, where you can feel, is
Yeah, exactly.
because for
Exactly. Because for the breast, you can do self-examination, you can
correct.
go for a mammogram to see if there are any lumps or tumors. But for the ovary, which is like inside your body,
Mm,
which you can't feel, that's going to
yeah.
be a bit more difficult in it.
Yes.
Yeah, can
Yeah.
see that. Okay.
So a bit of about the staging. So stage 1 basically means when the cancer is at the ovary.
Okay. Okay.
Stage 2, where it has already spread slightly outside of the ovary to the side of the tummy, or
I
sometimes,
see. Okay.
yeah.
Mm-hmm.
Stage 3 basically to the lymph node or to the lower part of the uterus, or sometimes
Okay.
up to the vagina as well.
Mm-hmm.
And stage 4 basically means yes, already had spread to other parts of the body, for example, the lungs, the liver, the bones. Yeah.
I see. Okay. Yep. All
Yep.
right.
And the symptoms for ovarian cancer, usually they overlap and they are very non-specific. So um, the main symptoms which usually the patient complains are, it's bloating, bloatedness. That means they have early satiety, they eat a small portion of food and then they feel full.
Oh,
So
I see.
again, these symptoms are not specific, because if you have stomach problem, or if you have even in pregnancy as well, you get the same symptoms as well. So like I said, it is not very specific for it. But
I see.
sometimes they can come with pain as well, especially if the cancer is compressing on other organs or compressing on the bowel. It can cause obstruction to the bowel as well. Um, Weight loss, unintentional weight loss. That means you have good appetite, but you keep losing weight, yeah. So that's one of the warning signs as well. So all these symptoms, they are not specifically for ovarian cancer. So a lot of times, you get bloatedness. People will just ignore the symptoms. They think it's because of other problems. So hence the reason why people come, when they're diagnosed with ovarian cancer, it's often
I
already
see.
stage.
So basically it differs for each and every individual.
Yes, that's right.
I see. All right. All right.
Okay. So this is one of the guidance that by the UK, the NICE guidelines. So they recommend that if you have the following symptoms 12 or more times a month, then you should see a doctor. That means swollen tummy, bloatedness, feel full quickly or loss of appetite, any pain in your abdomen, and when you need to wee more often or urgently. So if you have all these symptoms, go and see a doctor. Then the doctor will perform some tests to see what's wrong. Yeah.
Okay. Perfect.
Okay. So this is the causes of ovarian cancer. A lot of times, most of the time, there is no it happens by chance. Ovarian cancer happens by chance.
I see.
That means we don't have the specific cause of how it happens. And sometimes it is because of a genetic condition, which we will cover it a bit later.
Mhm.
When you have strong family history of ovarian cancer and some genetic condition, we call it a BRCA or other genetic condition,
Right.
which
Yeah.
increase risk
Yeah.
of getting ovarian cancer. So
Mhm, mhm,
that would be
mhm.
one of the reason, one of the uh, cause for ovarian cancer, but it's not, it doesn't happen in all the time. So most of it, ovarian cancer happens by chance. Of course, other
I see.
non-modifiable risk, for example, the age, the risk of getting ovarian cancer is just increased with age, but the one we cannot do anything about it, right?
I mean, because I think that cancer is not caused by one factor. It's
Exactly.
such complex disease that a lot of
Yes.
factors just play
Mm.
into it, and then boom, you get cancer.
Yeah.
So I
Yeah.
think people need to realize that, if you engage in like one specific practice,
Mhm.
it doesn't mean that you will get cancer, because as
Yes.
you said, it's purely by chance, and we
Yep.
have no way of determining exactly what can cause this type of cancer. So that's
Yes.
what makes it so frightening in the first
Yeah.
place. Yeah,
So
yeah.
cancers generally not only ovarian, but cancers they are usually multifactorial. It's not because of one
Yes.
single factor. But of course, if you carry this specific gene, then it
Ah,
increases.
yes, of course.
But it's often multifactorial. That means there are a lot of factors which can increase your risk. It doesn't necessarily cause cancer, but increase your risk of getting it.
Okay, perfect. Okay.
Possible protective factors. This is just I wrote there possible. So there have been studies that said patients who take combine the contraceptive pills, they actually reduce the risk, but you shouldn't be taking just because you want to reduce the risk of ovarian cancer, you go and take contraceptive pills. It doesn't work that way. It's just a possible protective
Okay,
pills.
I
Other
see.
other possible protective factors are, for example, pregnancy, breastfeeding. All this is because when you are pregnant or when you are breastfeeding, your ovary stop ovulating.
Ah, yes.
They
So
sort
they
of
stop releasing eggs. Yeah.
correct, yeah, sort of protect it a bit, yeah. And of course, with even with hysterectomy or tubal ligation, it will reduce the risk of ovarian cancer as well because um, a lot of times, most of the ovarian cancer, it starts from the tube, fallopian tube.
Oh, I see. So it's not
Yes.
at the ovary, it's at the fallopian tube.
Correct. It can happen at the ovary as well because there are many different types of ovarian cancer, different cellular types.
Oh,
So
I see.
most common type of ovarian
I
cancer, which
see.
is called the serous type, it
Ah,
often starts from the tube.
I see. Oh,
Yeah.
okay. But it's
Fallopian
still
tube.
classified as ovarian cancer.
So it's so we classify it. So ovarian cancer, fallopian tube cancer, peritoneal cancer, they often is being grouped in one group.
Ah, I
So because
see.
they are the
Okay.
same, they have the same pathology. So it's
I
often in
see.
yeah.
Okay. Okay.
Yeah.
That's
But for easy understanding for everyone, we will just regard it as a ovarian cancer.
yeah.
Yeah.
All right.
Okay. So this is what I mentioned before. There
Mm-hmm.
is a gene called BRCA, BRCA gene. This
Mm-hmm.
is a BRCA1 and 2. It increases the risk of, especially in the female, ovarian and breast cancer risk. So I'm sure this news, she is quite famous though, Angelina Jolie,
Yep.
because
I
she
see.
she she carries this gene, and to prevent her from getting ovarian cancer and breast cancer, she had an operation prophylactically
Yeah.
to remove her breast as well as both her ovaries. This is in order to reduce her risk. So out of all the ovarian cancers, 15% it's due to these two genes, BRCA1 and BRCA2. We call it the BRCA, BRCA1 and 2. So we'll touch about it later when we go through the MAGIC study. Yeah.
Okay. Sure.
Yeah. So how do we prevent it? We get this question a lot from the public, from the patients. You know, there are so many different kind of screening tests offered by different um, private labs.
Mm-hmm.
I wouldn't say they are not good, but once you go for this screening, you have to bring the result to a doctor so that the doctor, especially if you do tumor markers test, you have to bring the result to a doctor, a gynecologist, a specialist, for them to help you understand. Because if you just look purely on the result, it will only make you anxious.
Yes.
Yeah. So often they will do cancer markers, and people will just do this test, and when it's normal, they say, "Oh, it's normal, so I don't have cancer." But so the most famous tumor markers, not famous, like common tumor markers for ovarian cancer is called a CA125,
Okay.
where it is performed quite widely in the private labs. So we don't we don't use this tumor marker CA125 to screen whether you have ovarian cancer or not,
I see.
because this tumor marker CA125 is not very specific and sensitive to detect ovarian cancer.
Oh,
Even, yeah, so in 70% of the time in stage 1 ovarian cancer, these tumor markers can be normal.
I see.
Yeah.
Wow.
And and these cancer markers, these cancer markers, it can
Uh-huh.
be placed in many situations other than cancer. For example, if you take this blood test during pregnancy, it will be raised as well. Yeah.
Oh. Oh,
If you
okay.
if you
Okay.
have if you take it during menstruation, the level will be increased as well.
I
And
see.
yeah, in many other different situations, for example, if you have endometriosis, if you have infection, urine infection, or any infection going on in the tummy, it can cause, I mean, the level will be increased as well. So
I see.
this test is not a very sensitive and not a very specific test. Use
Yes,
it
I was just about to say
alone.
that. Yep.
Yeah. So for us to diagnose ovarian cancer, we not only look at the level of this test, we will look at many other factors as well. In
Mm.
scans, in our examination, the doctors will touch your tummy, your
Uh,
history. It's important to take a proper history as well. So in order to get to the diagnosis of ovarian cancer. So we don't usually rely on CA125 alone to 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 confirm if you have ovarian cancer. So it's all, a doctor will not look at just one lab test and say you have ovarian cancer. Usually we'll need to investigate
further.
in, yes.
I see.
So ultrasound, it's a very common tool as well. People use it to, especially in gynae. So if you visit any gynae, they will do a ultrasound because it's a very simple and non-invasive test. It can be performed through your tummy, and sometimes if it is needed, we will do an internal ultrasound as well, where a small probe will be put into the vagina and to do the scan. So sometimes a vaginal scan is more accurate compared to the abdomen one. So the doctor not only rely on the test, they will touch your tummy and the doctor will perform a ultrasound. And in certain cases, if we have like diagnosis dilemma, we will send you to do a more specific scan, for example, the MRI or a CT scan, to help us to look further, more details into your tummy. Yeah. So the biopsy. So once we have suspect you have an ovarian cancer or ovarian mass, a mass in your tummy, in some situations, the doctor will advise you to go straight to the operation. But in certain situations, if let's say we suspect that the cancer has already spread to surrounding structures, to the lymph node, the doctor will do a biopsy to where the doctor will insert a small needle to get a small piece of tissue from any parts, for example, from the ovary or from the lymph node, to confirm the diagnosis first. Then sometimes we will do an operation, a keyhole operation, to obtain the tissue for diagnosis. Yeah.
Okay.
And a lot of times when it's already advanced stage, a patient will get fluid in the tummy, and the doctor and the whole tummy will be distended. So the doctor will put a small tube into the tummy to drain all the fluids from the tummy as well. And we might we can get a bit of clue or diagnosis from the fluid that we collected as well to help us to diagnose ovarian cancer. Yeah.
Okay.
So just
So
a brief,
these are the treatments.
correct. I will just go through very briefly on the treatment. So the
Okay.
main treatment will be the operation. Other than on top of that, depending on the stage, depending on the type, the doctor will give you chemotherapy. And in nowadays, there are a lot of targeted therapy available in the market as well. So the doctors will use that as well. So radiotherapy is not often being used for ovarian cancer, but in their specific situations that an oncologist will use an radiotherapy for ovarian cancer. For the operation, if it is early stage and if the patient is young, we will only remove the ovary. But if let's say the patient is already menopausal and the disease involved, let's say it has already spread outside of the ovary, then we will have to more often we have to remove the uterus, the tubes, the ovaries, the cervix, sometimes all the visible lesions as well. Sometimes we will remove the omentum, the lymph node, and if let's say it involved the bowel, a small part of the bowel may be needed to be removed as well. So chemotherapy, sometimes it's given after the operation, and in certain situations, it can be given before and after the operation. So the reason of us giving the chemotherapy before the operation is to reduce the size of the cancer, and so that during the operation the bleeding will be much lesser and the morbidity will be much less. Then we call it a neoadjuvant chemotherapy. Yeah. Sometimes it is already too advanced or the patient is not fit enough for the operation. Then we will give chemo on its own without any operation. Yep. Targeted cancer drugs, it's quite, not to say new, but it's widely available as well. But the problem in Malaysia, especially in the government hospital, it is not being subsidized at the moment. So the mainstay of the treatment is still operation and chemotherapy. But if let's say you carry this specific gene, like I mentioned before, the BRCA1 and 2, so this particular drug, olaparib or niraparib, and there are many other different drugs which can be useful as well. But however, it is not being fully subsidized by the government. So, so unless you have, for example, insurance coverage or if you can afford, then you can get this. Well, but this treatment is not for all the ovarian cancer, only specific. If you carry this specific gene, then you might benefit from this targeted therapy. Next, I will touch a bit on the misconception. I'm sure we will get quite a lot of questions on this. Whether is there any specific food or any specific diet which increase your risk or which even cause cancer? So, in our point of view, there is no specific diet or food which directly can cause ovarian cancer. Yeah, so especially if you're going for operation, if you're going through chemo, it is very important for you to take a balanced diet. Increase in the protein. So there are certain patients after the operation, they say they cannot take eggs because of hearsay, because of increase the risk of infection to the wound. I think because the egg yolk looks like a pus, so a lot of times they are worried to take eggs. But actually, eggs are a
So
very
they're
good.
fine.
Yeah, it is absolutely fine. It is a perfect source of protein, and they should actually take it. Yeah, even
Okay.
chicken also. Certain patients, they are so worried to take chicken, but it's a very good source of protein. Yep. So that's just a short introduction. No introduction, like sharing of what is ovarian cancer. Yeah.
Yeah, very informative presentation though, because you've gone in depth into what ovarian cancer is, where is it located, you've gone through the stages, etc. So hopefully the attendees for today, they have more or less an idea about ovarian cancer, as well as, what's the situation here in Malaysia, because you did
Yeah.
mention that it's slightly increased. It's still top 5 for the cancers here in Malaysia, but then it could be because of awareness. People are taking tests, they're doing this and that, so there's more diagnosis on ovarian cancer. So it could
Yeah.
be anything. Yeah.
Yeah.
All right. So thank you for that presentation. Very informative. I think I've managed to learn quite a lot as well, Dr. Teo. So right now, we will go more into the magic study. Is that okay?
Yep, sure.
All right. So I'm sure the attendees, they're wondering, what is this magic
Yeah.
study we are talking about? So can you tell us what is it and what was the reason that it was implemented in the first place?
Okay, so MAGIC is the short form for mainstreaming genetic counseling for ovarian cancer patients. So,
Okay.
so basically, what is mainstreaming? Mainstreaming basically means to provide genetic counseling to the patients, not by the genetic counselors, but by the doctors or the physician who's seeing the patient, because we are lack of genetic counselors, number one, and number two, because the physicians often see the patients more frequently compared to the genetic counselors, because they see them before the operation, they see them after the operation, they see them during the chemotherapy and things like that. So there is already a rapport in it. But sometimes the physician, the oncologist, they are not well trained in terms of genetic counseling, the way of counseling. So mainstreaming basically is to incorporate this genetic counseling into the clinical practice and to provide counseling to the patients, genetic counseling to the patient. So this study was actually performed a few years back, I think 2017, 2019. Yeah. And it actually because especially in the government sector, in the Ministry of Health Hospital, there are absolutely lack of genetic counselors. So a lot of times, the doctors has to provide this genetic counseling. So these studies actually look at whether the patients are satisfied with the counseling provided by the doctor or genetic counselors, or whether the doctors are actually comfortable providing this counseling, and the results are actually very good. That means the patients are actually very satisfied with the counseling by the doctor itself, and also the doctors are actually very comfortable in providing this counseling to the patients also.
I
Yeah.
see. Okay. So, actually, why did you decide to be part of this collaborative study with Cancer Research Malaysia? So, did you like volunteer, or did someone reach out to you? So, how did you actually get into it in the first place?
Yeah. So the CRM reached out to us because UMMC is one of the one of the referral centers for gynae cancers. So I mean, it is a good study
Okay.
because I mean, we are quite lucky because we have a genetic counselor, So which
Yes,
is
yes. My
very
colleague.
correct. Yes, yeah, your colleague. So
Yep.
I mean, we get to refer cases to her very easily. But like for other hospitals, for example, in a public hospital, they don't get this genetic counselor service so
It's
easily compared to us. But so it's a good because we see patients every day. Um, and for example, if we would want to refer, and Sui is the only one I would say that we often refer to. So if we refer all the patients to her, and the appointment is going to take long, and for so many patients. But for us, because we see them in the clinic, we see the patients in the daycare, so we have a lot of encounter with the patient, and I would think that by doing this genetic counseling by us, patients would benefit as well, so that they don't have to go for additional clinic visit, and the waiting time would be much less as well. And possibly it will increase the uptake in the genetic testing as well.
yeah.
Yeah.
I think this makes sense because earlier you mentioned in your slide something about how people can have an increased risk of getting ovarian cancer or breast cancer if they have inherited the BRCA1 or BRCA2 gene, right?
Correct.
So yeah, I think that actually makes sense, because if people have a family history, if they know that, their mother or their grandmother or some distant relative has had ovarian cancer or breast cancer, they can easily just go get it tested, and they will have to meet up with a genetic counselor, and then they'll know about their cancer risk. So I think that's the entire gist of the MAGIC study. Am I correct?
Yes, correct. So I would need to explain because for ovarian cancer, we don't routinely check for this gene, the BRCA1 and BRCA2.
Mhm.
So if let's say if you suspect if this particular patient has a very strong family history of cancers, breast, ovarian, prostate, colon, things like that, then we will counsel them to go for this testing, because we don't routinely do it, because one of the reasons is it's not free. Yeah, we will need to send the test to in we do it in-house, but in certain hospitals we need to do it in a private lab, so it's not free. So a lot of patients, they couldn't afford this test, so we will only select or counsel those patients, but if they can afford, then we will proceed with the test. So when we want to offer them to do this test, the counseling is important, because they will need to understand what test that's for and the implications of this test after they have the result. Yeah, so a lot of counseling is involved in it. Yeah.
I see. Okay, that makes sense. So, as of now, so how far has Magic come so far today, and how do you feel about its progress, compared to 2017? You said that's when the study
Yeah.
started,
Yeah.
right? So how do you feel about it?
Well, we are doing whatever that is in the MAGIC study as well. So we are providing a lot of genetic counseling to the patients as well, and certain eligible patients, we do counsel them to go ahead with this testing as well. So I guess so we are practicing whatever that is being practiced by this MAGIC study,
I
providing
see.
counseling. Yeah, and
Okay.
I would say a lot of patients nowadays, because of the uh, awareness as well, so they are more aware of this, not only BRCA testing, but in general, there are many different other genetic tests as well. So they are more aware of it. So more patients can afford, and more patients actually chose to do these tests as well. Yeah.
I see. That's good, actually. That's good. It's awareness. That's
Mhm.
very important. I think people need to know, because that's how powerful that knowledge is. Because if they don't know about it, then they can't do anything about it. And
Yeah.
well, another worst case scenario is that they're aware of these symptoms, but they don't know exactly what to do
Mhm.
to get help.
Correct.
So we want to avoid that, and that's why I think Magic, as well as your work, is very meaningful for patients who may be diagnosed with ovarian cancer, because we want to help people beat cancer in the first place.
Yes. Yeah.
Right. So did you manage to face any challenges when you were implementing the Magic study?
The main challenge is
Yes.
cost.
Cost. Yeah.
Cost.
Of
Yes.
course,
Because
money is always the
yes.
problem.
Yes.
Makes
Because
sense.
yeah, because this genetic test is not free. I mean,
Yeah.
we have the option, the free testing option, um, but generally it's not free because it's not offered in the government hospitals, in our even in our university hospital, because it's not free. So a lot of times it's that is the main challenge. The patient would not go for this testing. A simple BRCA1 and BRCA2 test costs about 1,000 ringgit.
1,000. Oh,
Yeah, and a lot of times patient for that. And the other problem would be, once they are tested positive for this particular gene, um, if you are to offer them the targeted therapy, the olaparib and things like that, it will be another huge amount of money. So a
Mm,
lot of can't afford it. So hence this, they will say, they would think that, oh, if I can't afford the medicine, why would I need to do the test? So yeah, that is one of the main challenge that we face.
I see. Is it true that not everyone is eligible for the genetic testing?
If you have, so there are many different types of ovarian cancer, different
Okay.
pathology, different types of cancer cells.
Mm-hmm.
So there are certain cells which are not linked to this gene, which is not because of this 40 in the gene. So in that group of patients, then we will not offer them this genetic testing. And also before we offer them the testing, we will look through, we will ask them through a proper family history as well. If we think that they are at increased risk of inheriting this gene, then we will offer them this test.
I see. Okay. So I think that's actually all the questions I have regarding magic. Don't want
Mm.
to go too much into detail, but basically just to summarize it, it's
Mhm.
a collaborative study between, doctors like you, specialists, healthcare specialists like you, and Cancer Research Malaysia. And it's just because we want to make genetic testing and genetic counseling more accessible to the
Yes.
Malaysian public. So
Yeah.
that's basically the summary of it. And I think we've actually gotten very good results so far, because based on the data that
Mhm.
I received, you managed to increase it from 2% to more than 50%.
Mm.
That's the data that I got. I think that's a very significant milestone. It's very good. So hopefully there are higher accessibilities for Malaysians, because everybody wants to avoid getting cancer in the first place. And I think that prevention is the best cure.
Yeah, definitely.
Exactly.
Agreed.
All right. So are there any myths or misconceptions about ovarian cancer that needs to be dispelled? Like, what do you think is the most common myth about the disease?
Right. So in contrast with other types of gynae cancer, so ovarian cancer do run in the family. So like because of this gene, because of this problem
Mhm,
in the faulty gene, if they carry this BRCA1 and 2, um, because compared to other gynae cancers, for example, cervical cancer, they don't run in the family. So this is the truth. So, but a lot of myth that we receive, especially when the patient asks us, is whether ovarian cancer is, I think I covered in the slides, whether it's caused by any specific food or any specific lifestyle. If they don't sleep early, if they sleep late every night, would it cause cancer? Um, if they use handphone too much, would it cause cancer? Or if there's any specific food that they eat, they should avoid, to reduce the risk of getting cancer. So like I said, like we said, I mean, we all know cancers are multifactorial. So this is not caused by any specific food. It often happen by chance only. And in a lot of times, because out of all the ovarian cancers, 15% is caused by this gene, and other type of rare genes, it might cause cancer as well, but in a lower percentage. Most of it, more than half, we cannot find a specific cause for ovarian cancer. So it's not because of any food, it's not because of what the lifestyle or the phone,
mhm.
the hours of the hours you spend on social media, it will actually increase your risk of ovarian cancer. No, it doesn't. Yeah.
All right. Yeah, I'm pretty sure some people will always put phones as the excuse, like because you're always on your phone, that's why. Yeah.
Yeah.
But it's just a joke. It's just a joke that everybody says nowadays. And
Yeah.
actually, I did hear that
Mm,
that's another very common myth about ovarian cancer, in which if a
mm.
woman does a pap smear, she
Ah,
would be able to determine whether or not she will have ovarian cancer. Yeah. What do you
okay.
have to say about that?
Yeah. So back to the first slide. So
Mm-hmm.
pap smear is to detect cervical cancer. Cervix
Cervix.
is the neck of the womb. That means the lower part of the womb, the uterus. So it is of a different cause. So cervical cancer is caused by HPV, human papillomavirus infection, and a pap smear or a HPV test can it's a very effective screening to detect early precancerous or early cervical cancer. So pap smear is only good for cervix cancer. It is not good for it's not a tool, it's not a test to detect any ovarian cancer, any cancer in the fallopian tube, or any womb, any uterine cancer. Yeah. So, yep, we do get these questions as well. They say, oh, I did a pap smear already. It's normal. So I don't have any cancers, but it's a different part of the gynae organ. So, yeah.
Is it because the ovary is like so far behind? It can't
It
reach that far.
Yeah, so because no, so even with pap smear as well,
Uh-huh.
it's not to detect uterine cancer
I
as well.
see.
It's only for the cervix. Yeah.
So it's a completely different test.
Yeah, it's a completely different test, yes.
Okay, okay, that makes sense. All right, and my last question for you, Dr.
Mm.
Teo. So
Yep.
what is one advice you
Mm.
would give Malaysian women to reduce their risk of ovarian cancer?
To reduce the risk. All right.
Yes.
I would say because there's no effective screening test for ovarian cancer, um,
Mhm.
not tumor markers, um, even if you do regular pelvic scan, if you go and see your gynecologist every 4 6 months to do an ultrasound scan, sometimes it is not a very effective way of detecting early cancers as well, because studies have already shown it is not effective. So what is most important is listen to your body. That means if you think that something is wrong with your body, you get bloatedness very frequently. Um, your tummy is getting bigger and bigger each day. Go and see a doctor.
Mhm.
Go and see a doctor. The doctor will perform some tests, do some examination, and advise you what's wrong. Yeah. So um, listen to your body. Don't ignore the symptoms, and see a professional for advice.
Okay.
Yeah.
But
Try to
then
avoid.
there's like
uh,
one other concern,
mm,
because you said that there is no specific and
mhm,
no common symptom for ovarian cancer,
mhm,
and people can mistake these symptoms for
mhm,
something else.
mhm,
So what if you do get a symptom, turns out that it's ovarian cancer? Of course, you don't know it yet.
mm,
You
mhm,
go get it checked out by a doctor, and the
mm,
doctor tells you that it's something else. It's not ovarian cancer.
mhm,
So do you see where I'm going at with this question? So how do you know for certain that, even if you do recognize the symptoms, you go
mm,
see a doctor
mm,
and they advise you that, oh, it's perfectly fine. You can just go home and sleep it off or something. But turns out it's ovarian cancer. So how do you
mm.
avoid a situation like that?
Yeah. So if you think that the doctor is not like you're not satisfied with what the doctor's advice is, seek second opinion.
Second opinion.
Yeah, definitely. Yeah, we are all doctors. We are okay for you to go for second or third opinion, in fact.
I
So
see.
so if your symptoms persist after the first doctor, you think that you're not really satisfied with what the doctor has explained to you, go for second opinion. We are very open for it. Yeah.
Yeah, no, no, no feelings are hurt.
No, no, no feeling.
Absolutely not.
It's
That's
all about
completely fine.
providing the best care, for the patient.
I see. All right, perfect. So I think that's all of the questions that I have for you, Dr.
Mhm,
Teo. And
mhm.
then for now, we are going to open Q&A session. So
I
I
think
can
we are.
see that we already have quite a number of questions in the chat
Yeah.
box. You can go and
Yeah.
check it out first. So we shall see the one from the webinar chat box first. So
Okay.
the first question is, oh dear, everybody keeps moving. I can't see. Can you read the questions?
Yeah,
Can you
sure.
see it?
I think there are
One is from Joey.
yeah, it's not related to ovarian cancer, but I can answer. So
Okay, yeah.
uterine fibroid. So uterine fibroid is a totally different pathology. So uterine fibroid is a benign, it's non-cancerous lesions of the uterus of the womb. So 99 out of all the fibroids. So fibroids is just overgrowth of the muscle of the uterus. So 99% of the time it's benign. That means it's not cancer. But of course, there's no 100% in medicine. So there's less than 1% this fibroid may be cancer, but it's often very rare. Yeah. So it doesn't increase the risk of ovarian cancer because it's a totally different thing. It's just the muscle of the womb is overgrowth. Yeah, that's it.
Mhm.
Yeah.
Okay, so hopefully that answers your question,
Yeah.
Joey. Now we move on to the question from Mars. I have breast cancer stage 3, and now I consume oh dear, the thing
Tamoxifen.
just moved back up again because somebody just sent
So,
a question. Sorry about that.
that's
Consume
okay.
tamoxifen for 10
Tamoxifen.
years. So am I at risk to get ovarian cancer because of this medicine?
No, so tamoxifen does not increase your risk of ovarian cancer.
Okay,
Yeah.
straightforward answer. Love that. So hopefully that answers your question, Mars. And then we have another one from Angeline. Doctor, just a clarification. If I have a pinching pain at the breast, what is this cause?
This is a very how to say general question. So it's best go and see a doctor and have it checked. Yeah.
Okay. And then we have another question from Joey. Can you estimate how much is it for targeted therapy?
Okay. So it's okay. So it is quite expensive. I mean, it is. I would. The last I remember is about 17 to 18,000 a month. But there are many um assistance program, patient assistance program out there by this drug company, by a lot of charity where they provide assistance to the patient. Yeah. So they are. So we know if let's say you really cannot afford it and if you need it, we will find way or find ways to help with financial assistance to get this drug.
Okay. And hopefully that answers your question, Joey. And then we have another question
About
from Nur
HPV.
Hafiza.
Right. So HPV is HPV infection is human papillomavirus that it's vaccine to prevent cervical cancer. Yeah, it's given to the girls in the school. Yes, of course, boys can get HPV infection as well, but it's not covered. That means it's not they cannot get it for free in the school. So if let's say a parent want to give the injection to the son, they will need to pay out of their own pocket lah.
I see. Okay. And the next one, it's oh dear, I am lost in the back in the chat box. It's not very smooth. The next one is from oh, the e-certificate. The questions, let me handle that at the end of it, so you don't have to answer it,
Okay.
doctor. So I guess the next one is from Nadia.
Yeah, most of the symptoms went to gynae, TBS, show normal ovary, and CT scan show normal ovary, now under gastro pula. Yeah, so the symptoms sometimes can be very vague and overlap with ovarian cancer. So it is good that you had a CT scan and a TVS which showed a normal ovary. So it's probably not because of ovarian cancer. Yeah, so go and see what the gastro doctor see if maybe they can find out the cause for all the symptoms.
Okay, perfect. And we have another question from Tracy.
Increase. So CA199 is another tumor markers. Sometimes it can be raised in ovarian cancer, but also it can be raised in other pathology as well. So CT scan, normal results, but every few days I would have especially bloating and stomach pain. What should I do? It is really difficult to give advice. I would think the best is for you to look to seek advice back at the doctor again. Yeah, because if you have pain and bloating, yeah, the doctor would give proper advice for that. Yeah.
Okay. I think Joey has another follow-up
How
question
many
for
how many
the
months?
targeted therapy. How many
Yeah.
months is the treatment?
So there are many different studies or many research. Some give about 18 months after. So chemotherapy is the main treatment. You need to finish the chemotherapy. That is the mainstay of the treatment. You cannot, I mean, not to say cannot avoid, but that is the main treatment, most important. Targeted therapy sometimes is just like the icing on the muffin. So with or without icing, the muffin is the most important. So targeted therapy sometimes it can be given up to 18 months, up to 24 months. There are certain practices in other different countries where they give until um, your next, when the disease come back. Yeah. So it's a different regime, it's based on different oncologists practice as well, different hospitals. Yeah.
Okay. So
Mm.
another question is from Teo.
Yeah. So
Yep.
with the fertility chance reduced for 1A. So even with one ovary left, um, your risk of getting pregnant will be still the same. Yeah. So there's no reduction. It's not like half. It doesn't reduce your chance of fertility to half. Yeah.
Mm-hmm.
Yes.
Okay.
Still normal.
And then another follow-up from Angeline, who
Mm.
mentioned about the fibroids.
Fibroid. Yeah.
Yeah.
So fibroid it's very common. So for us doctors to decide which fibroid to remove is not based on the size, based on the number of the fibroid. It's based on your symptoms. So if this fibroid giving you a lot of symptoms, for example, heavy bleeding, you have very heavy menses. If you have a lot of pain, if this fibroid is pressing on your other organs, for example, your bowel or your bladder, then we will advise for the operation. It is not only depend on the size. Of course, size is one of it, one of the factor. If it is like huge, 30 centimeter size, of course, then we advise for removal. But most importantly is your symptoms. Yeah. So
Okay.
yeah, to remove it. If it is a small 3 centimeter, it's not causing you any problem. You probably won't even know it unless you go and scan. Then you don't have to go through you don't have to take the risk of operation to remove it. Yeah.
Mm, okay. And then we have another one from Marzania,
Hmm.
wanting
So
to ask about cervix cancer.
cervix. Is it true that most of the female gets cervix due to male because of the female get? No, it is absolutely wrong. So it is not because of the male. Um, so cervical cancer, this is another big topic, but cervical cancer is caused by HPV, human papilloma virus. Yep.
Mm,
High risk, I would need to say, I would need to stress this, is high risk HPV because there are many, many hundred types of HPV around us. So you can get the low risk type, which is the most common type. You can get it on your skin. It is transmitted through skin to skin transmission, but you won't even know it unless you go and test it. So cervix cancer is caused by human papilloma virus, the high risk HPV. So it's not because of male. Yeah, it's not
okay.
because of men. Yeah, even if you have one single partner your whole life, you will still at risk of getting this HPV infection. Yeah, so it is not because of infidelity or things like that.
Okay. All right. And the last question for
Mm,
the webinar chat, we'll move
mm.
on to the other Q&A later.
Okay,
So this is for Nurfatin.
so I have endometriosis, bilateral ovarian cyst with septated sex now on Visan. I did see 1 to 5 about 30-40. Am I risk of having ovarian cancer? Yeah. So with endometriosis, your CA125 will be raised. Yeah. So in her situation is 30 and 40. So which is acceptable if you have an endometriosis. So that is usually the doctors will monitor. So of course, if you ask me whether endometriosis, of course, endometriosis will increase the risk of ovarian cancer, but because since you're already on Visan, you already has endometriosis, so the doctor will continue the follow-up. So the most important thing is continue the follow-up, and if there's any change or anything, the doctor will advise you. Yeah.
Okay. All right. So now we move on to the three anonymous questions because they've been there for quite a while. We should pay a bit more attention to them. So one of them is asking about the eggs.
Oh, anonymous. Okay.
Yeah.
How does taking eggs increase risk of ovarian cancer risk? No. So answer life. So eggs, chicken eggs, fish egg, whatever eggs, it does not increase your risk of ovarian cancer. Even if you take organic eggs, kampong eggs, whatever the ma chao eggs, whatever eggs, it does not increase. So I always tell my patient, even once they have diagnosed with ovarian cancer, you do not have to go extreme in terms of your diet. Some patients go no salt, no sugar, no oil. That's a bit too extreme. So just go for a balanced diet. Yeah, that is the key, not only for cancer patients, but for everyone. Even if you are healthy, if you are young, everyone needs to have a healthy diet. So it doesn't matter which type of egg, where is it from, from imported from whatever country. As long as it is eggs, it is good for you and it does not increase of risk of ovarian cancer or any cancers. Yeah. What
Okay.
type of ovarian cancer is more associated with faulty BRCA1 and 2 gene? So specifically serous type, which is one of the, there are many different types of ovarian cancer, but serous type is one of the most common cause, which is caused by BRCA1 and 2 gene.
Then the next one is about chemotherapy.
Should chemotherapy given 1A? So it depends on what type of but generally stage 1A basically mean is very localized, is in the ovary as well. But we will have to look at many different factors as well, whether this is completely excised, the age of the patient, what is the type, the cell of the ovarian cancer, to help us to decide whether you need chemotherapy or not. But generally, stage 1A, they do not usually need chemotherapy, but unless they have other risk factors. Yeah.
Okay, and the last one.
If there are any tests to determine if there is any spillage after ovarian cancer surgery removal, there is no test specifically, but if there is any spillage, so we will, as a surgeon, when we remove any ovarian cancer or when we do a cyst, we will try as much as possible to avoid spillage. But of course, sometimes we cannot guarantee 100% that we will not spill. Yeah, because sometimes the cyst might be already ruptured before, when we go in for operation, the cyst might already been ruptured. So there is no way or no test to detect whether it's any spillage or not. But usually we will try as much as possible to avoid spillage during operation. Yeah. So after operation, after removal of anything, usually we will just wash the whole the tummy, the operation field with water and to clean the whole area. That sort of reduce. I mean, if there's any spillage, it will reduce the risk as well. Yeah.
Okay, perfect. So I think we have to close the questions because we've been, I think that's a lot. Everybody has a lot of questions about ovarian cancers, fibroids, targeted therapy,
Yeah.
etc.
HPV.
But unfortunately, because of time constraints, we have to close the questions right now. But Dr. Teo, I'm just thinking about sending them your email if that's
Yep,
all
sure.
right. All right,
Yep.
because I'm just typing in the chat box right now. Your
Yep. I
email
will just.
is Teo. Actually, I'm doing
Yep.
it right now, so it's all right.
Okay.
Yeah, so
TEOIH.
teoih@ummc.edu.my.
Yes.
Okay, so I'm just sending it. All right. So for those of you like Angeline, another question from her, as well as I can't get around this cursor, as well as Hong Yuting. So if you have any
Yep.
questions, there's his email over there.
Sure.
So you can reach out to him. Okay, so now let's cover the burning question about the e-certificate. Yes, we did mention that with a minimum donation of RM1, you'll be able to get an e-certificate from Cancer Research Malaysia, just to show that you have attended this webinar. So tomorrow, check your email inbox because we will be sending you a feedback form. So in that feedback form, there will be an option at the bottom in which whether or not you want the e-certificate. And if you say yes, then you will have to show your proof of transaction for the donation. And then we will send you the e-certificate within 30 days after this webinar. So it's on the 26th right now. So you'll have to wait for within the 30 days time frame. Then you will get the e-certificate via email. And if you still have any questions about the e-certificate, you can just email us at Cancer Research Malaysia, or if you haven't received it, you're concerned that we have forgotten about you, just reach out to us and we will get back to you as soon as possible. So hopefully that clears up any questions or any inquiries about the e-certificate. Yeah, I know it's very important to some people. Yeah.
It
All
is.
right. Yeah, all right. So actually, yeah, so once again, thank you so much, Doctor. I'm sure all the attendees here are very grateful for your insights and your knowledge that you have bestowed upon us. So yeah, I've also managed to learn a lot of things from you as well about
Thank you for
ovarian
the
cancer.
invitation.
So yeah, I think that concludes well, that essentially concludes our webinar. Oh, and unfortunately, we do not offer any CPD points with this e-certificate, just to FYI. So we don't have any points for that. It's just a plain old certificate. So hopefully that answers your question. And I think that's basically about it. Thank you so much, Doctor.
Thank you
So
for the invitation.
hopefully we'll get to have another webinar again, maybe sometime in the future. That'd be great.
Yep, definitely.
All right. Oh yeah, and for payment, just the details are in the feedback form. You can scan the do it now QR code, or you can just transfer via Swift code or our bank account. It's all in there. All right. So perfect. Thank you so much, and enjoy your lunch, everyone.
All right. Bye-bye.
Goodbye. Thank you so much.